What an exciting day I can imagine for Mercy Health today. Talk about this project a little bit.
Yeah, this is a really great day for us. This project has been in the works since at least 2016, and to see it come to fruition after so much effort and so much time is really something special.
At first, there was talks of a full-blown hospital, right? And then that kind of shifted to just what we have today, which is what, an emergency room and imaging, or what is it?
Yeah, today we're celebrating the groundbreaking of an emergency department, a freestanding emergency department, but with also a full suite of ancillary services. So diagnostic imaging, laboratory services, and others.
Can you talk about the shift, why it went from full-blown hospital to what it is today?
Yeah, Mercy Health Youngstown is part of a very large organization, and we're continuously evaluating and reevaluating what the needs are in our various communities and how we can meet those needs. Frankly, the two specialty hospitals that we're building in Liberty Township are projects that ended up getting in front of this project in terms of the launch. So we're very happy. The first of those, the rehabilitation hospital, is now open. The behavioral health hospital will open later this year, and now we've been able to circle back around and get this project in queue.
You mentioned 2016, so this, I mean, that's 9 years ago. You guys were already thinking about this.
Absolutely.
Talk about the vision. What did you guys see and see a need for something like this here?
Yeah, we saw the Trumbull County community growing in the future. We've actually seen that come to fruition now, but at the time the thought was that we're going to need to be able to expand our services. We're going to need to expand into a void that exists where services aren't being offered. And that was one of the things that drove us to this site slightly further north than our current site at St. Joe's.
And it's really merely just a coincidence that it's happening as a couple of hospitals in Trumbull County have closed. This is something you guys have been looking forward to and working on for years before that even happened.
Our strategic planning and our capital planning from a financial perspective for a project like this is years in the making.
Right. Right. Does Trumbull County, what else does Trumbull County need?
When we look at the services we provide today, we're continuously reevaluating the clinical needs of the community, and I think that's one thing that sets us apart from a lot of health systems. We're very rooted in this ability to serve the clinical needs, serving people closer to their homes. And when we look at the services that we offer today in Trumbull County, they're rather comprehensive. The challenge that we face is some of our space is a little bit aged, and some of it's a little bit small. Not necessarily in terms of the number of rooms or the number of units, but just the overall space that we're in. So we're really trying to grow out beyond those walls in many, many ways, and we feel this property in particular gives us the chance to evolve over many, many years in the future.
Right. When it comes to Mercy Health's vision in terms of expansion and adding healthcare access, what factors go into the decision-making process?
Yeah, we use a very comprehensive set of tools to look at where services are being provided and where gaps in services exist. And we actually seek out those gaps.
Yeah.
So those gaps drive our decisions, and then we back in to see if it makes financial sense to offer the services. We kind of do it backwards compared to some other organizations where we allow the clinical needs to drive those decisions.
Right. What does the future of healthcare look like, you think? Technology is rapidly evolving and changing. I know I've talked to some that believe in-home access may become a bigger thing down the road, but how do you kind of see it? There's so much outpatient now where people are going home the same day for major surgeries. Just how do you kind of see this?
Yeah, it's evolving right in front of us.
Yeah.
Right, and that's the challenge. We have to try to build facilities and processes that are, quote, future-proof. That can be very difficult sometimes because if you look at something like artificial intelligence, we don't even really know what that's going to be 5 years from now, right? So we end up looking at population data and saying, hey, how do we best care for the population in a given community?
I know your competitors with companies like Southwoods, Salem, Cleveland Clinic, but how important is it just in terms of healthcare for companies like yourself to just continue to expand and meet the needs of the people in these communities?
Yeah, we really don't build our strategic plan around any particular competitor. We're rather agnostic to that, to be perfectly honest. We build our strategic plans with a much longer glide path than many companies do. Again, we've been here for 114 years in the Mahoning Valley. Our plans really are measured in decades when we start to think about it. So we really don't try to respond to the ebbs and flows that occur every day, but rather what we see as those long-term trends.
and obviously you're going to follow your strategic plan and everything moving forward. But I mean, it just seems like Mercy Health continues to grow and expand services all over the Mahoning Valley. I'm seeing new things pop up everywhere.
Yeah, and we've been very blessed. You know, we've been blessed to have the opportunity to step in and fill some of those voids. Some of the voids we fill are voids that are difficult to fill. The behavioral health hospital that we're opening in Liberty Township, that's a difficult void. We are now the sole health system provider of inpatient behavioral health services in the region. So the question is, how do you do that, and how do you do that effectively, and how do you do that in a high quality, sustainable manner?
Right.
So again, we try to fill voids, not necessarily the voids everybody else is looking at, but voids that we identify in the community, and that allows us to be successful when you have the long view in front of you.